Welcome to the RxMinute, brought to you by RxBenefits. In this segment, we'll discuss deductibles versus copays. Copays and deductibles are both features of health insurance plans. They both involve payment on the part of the insured. The differences between a deductible and a copay are the amounts and the frequency. A deductible is a fixed amount a patient must pay before their health insurance starts to cover a larger portion of their bills. For example, if you have a $1,000 deductible, you must pay $1,000 out of pocket for your prescriptions or care before your insurer starts covering a higher portion of costs. A copay is a determined rate you pay for prescriptions at the time of purchase. For example, you may have a $10 copay for each monthly Tier 1 medication you fill. How do these two figures work together? If there is a deductible, you would first be responsible for meeting that amount. Once met, the amount out of pocket would be no more than the amount of the copay. Let's look at them together through an example. You go to the pharmacy in January, the beginning of your plan year, to fill 5 prescriptions you have been on for the past few years. Your annual deductible is $500, and your copay for each of these medications is $20. Because it's the beginning of your plan year and you have not yet met your deductible, you'll pay the full amount. At $50 for each of those medications, that's a total out-of-pocket of $250. In February, you fill these same 5 prescriptions, and once again, pay the full amount for each of these drugs since you have only met $250 of your $500 deductible. In March, because your February purchase met your deductible, when you arrive at the pharmacy to pick up your 5 medications, you only have to pay the $20 copay for each of these medications, a total of $100. From this point forward, you will only pay the copay amount for any medications through the end of the plan year. We hope you found this information helpful. Thank you for watching this edition of the RxMinute, brought to you by RxBenefits.